It was down a little bit, 175 over 99, which is still very dangerous. And then on my way home at 12:30, I stopped at the fire department and had it, and it was still very dangerous at 162 over 90.
You went to the fire department?
Yes.
Where?
On 19th Street.
Okay. You just stopped in the fire department?
Mm-hmm.
Have you done that before?
Yes, I have. When I got the initial letter from a doctor saying that I threatened him, I knew nothing about him. I called that office trying to find out what it was about, how I threatened who, when, with what. They wouldn't answer. They hung up. And I took the letter directly to the police station, and they said if this was true that I would be in jail.
Mm-hmm.
The thing that makes these persons or dealing with them difficult is that our current system doesn't support giving them the needs, meeting their needs.
Mm-hmm.
So a person with mental illness, you may need to spend a little more time with them to understand their concerns. You may need to spend a little more time allowing them to express themselves and developing a relationship or a rapport, because they may be suspicious or their thoughts may be disordered, and they may really struggle with engaging in an interpersonal relationship like the physician-patient relationship.
Mm-hmm.
And so if you have those challenges, but our current system, as you know, the medical system is a couple of minutes per patient, in and out of the room, let's get it done quickly, that model is not a good fit for meeting the needs of these patients.
I've been also told that I'm bipolar, which if you're bipolar, you should have follow-up. You should be on medication. I've never been on one pill for depression of any kind. That doesn't make sense. Everyone is bipolar.
Mm-hmm.
And that's going to get worse if I have it without medication or follow-up. Last year I was diagnosed with a colon tumor. I had problems getting a doctor to do my surgery. I had to leave the county. I could not find a doctor to treat me. I needed medication to deal with the grief, which I was told by a psychiatrist in the emergency room that you're not supposed to grieve over loss of your family member, let alone being your husband, which is totally ignorance.
Mm-hmm.
It's equally frustrating for the physicians that most physicians go into medicine and most mental health people go into to help people. And when they feel they're not able to do that, they would rather not have that person on their caseload or not have that person be a part of their panel. So it is unfortunate that it does happen.